9:30 for the Health and Human Services Committee meeting. The first thing we're going to start out is public comment. Is there anybody here? Yes, come on in. Remember, you got 3 minutes, so.
Yep. Teresa White, Robinson Township. Again, I am focusing on the coordinating councils. This information comes from past meetings of this committee, the Health and Human Services. In 2012 begins the organizing of the nonprofits. Nonprofit Next gets mentioned as the way forward for nonprofits in Ottawa County, stating we have a huge number of them. The very next month, mandates from the state are removed for coordinating councils, yet Nonprofit Next comes right back up. This coordinating council is connected up with the initiative of Holland Zealand Community. So there is no state mandate, yet Ottawa County starts establishing their own, seeming to have the name Ottawa County Human Services Coordinating Council, which I've been told is just a collaboration, not a real entity. Yet this council has received a grant from Ottawa Zealand Foundation in 2011. In 2010, the previous administrator, Mr. Al Vandenberg, says he is having a hard time shutting down Lakeshore Coordinating Council because they don't want to give up their Medicaid dollars. He is still trying to get them shut down in 2016. So my question would be, are Medicaid dollars coming into these coordinating councils directly from the state or through Ottawa County Public Health or Mental Health departments? The money should have been stopped once the state mandates came off. And now Ottawa County has another nonprofit entity named Care Ottawa, which just so happens to be a bucket manager for ARPA funds. These two foundations, again, Holland Zealand Foundation and Grand Haven Area Foundation, are included here also in Care Ottawa. This seems to be the way this cathedral operates. Foundations funding their own initiatives using certain nonprofits, almost like a utopian government-run model community. Thank you.
Is there anybody else? Okay. Consent items. Can I have approval of the agenda?
So moved.
Support. All in favor, say aye.
Aye.
Next one is approval of the proposed minutes from the August 10, 2022 Health and Human Service Committee meeting.
So moved.
Support.
Support.
All in favor, say aye.
Aye.
Thank you. Action items, none. Discussion items. Public. You for waste.
Yeah.
Conference room.
Thank you.
Waste
Waste.
Conference room.
I knew it, I couldn't think fast enough. I wanted solid waste. That's what I wanted to say, but I'm not quick on my feet. Anyway, okay, discussion items. First one is public health response to STEC toxic producing E. coli outbreak. Rebecca Folker and Kayla Anderson, Senior Environmental Health Specialist at Ottawa County Department of Public Health. Kayla, I hear you're here all by yourself.
I am.
So the floor is yours.
Thank you, sir. So if I can just kind of kick this off, hopefully you remember the last time we convened, we talked a little bit about an emerging outbreak of STEC.
Yes.
And so today we're sort of at the other side of this now, and Kayla's just walk us through kind of what it looked like internally and externally to give you and our audience here just a better understanding of what really happens during an emergency outbreak.
Okay, and we talked about it, and you had, I don't want to put words in your mouth, but you had no idea where it was coming from. And it wasn't Ottawa County, it was in Kent County, and it wasn't in other states too.
When we
Mostly in
first
Michigan.
started, I believe at the last meeting, we were aware of cases in Ottawa County. We were at the beginning of kind of piecing together what potential sources were, which is always part of an investigation. And then upon doing that investigation, we learned that there were other cases around the state and in other states. And Kayla will go over all of this.
Okay.
So
Okay,
it's gonna be
but I just want
super
Give it a
interesting.
little background of where.
Yeah, yep.
Okay,
Thank you.
go for it.
Great. Thank you, Lisa. I appreciate that. Welcome, everyone. Thanks for joining us today here. My name is Kayla Anderson. I'm with the Ottawa County Department of Public Health, Senior Environmental Health Specialist. And I'm here today to give you a glimpse behind the scenes into the recent Shiga toxin producing E. coli outbreak response. As you know, the outbreak has received significant media attention from TV, news articles to breaking news stories, as this feature from 13 on your side.
Uh-oh.
Madison needs to do her magic.
Yeah. There we, oh.
Well, maybe she won't do her magic.
Oh, here it is.
There it is. Thank you.
There are 14 cases of Shiga toxin producing E. coli infections in the county. 5 cases are hospitalized. 2 cases have what's called hemolytic uremic syndrome. Haley's mother, Jenny, says her daughter is one of the 2 with HUS, and she has no idea where her daughter could have gotten E. coli, but is really hoping that the county health department will soon have more definitive answers.
As the mother is stating in the video, she's hoping that the Ottawa County would have answers soon. And that's exactly what we were working toward during the investigation. As an overview, as of August 25th at 2 p.m., Ottawa County had 13 cases that were reported throughout the month of August. 6 were hospitalized. Out of those 6, 3 pediatric cases developed a symptom called HUS, which often leads to kidney failure.
Stop, I'm gonna stop you a minute,
Sure.
okay? HUS,
Hemolytic uremic syndrome.
okay.
Glad you asked.
Yeah,
You know what that is then, right?
Yeah, right, very clear. As what, Lisa?
Fortunately, we have a
Gwen,
doctor in the room to
Gwen?
explain that.
Is that happen quite often if they get really sick? Or,
So this is a known complication of this particular type of E. coli bacteria.
okay,
And it can be very, very serious. And so hemolytic refers to problems with the blood cells themselves. And then uremic refers to problems with the kidneys. So in this particular case, I don't have all of her details in front of me, but
No.
these kiddos were really, really sick.
if they get the kidney problem, is it permanent?
It can be. And in this particular case, I believe they reported in the news story that she was on dialysis at a very young age, which is, yeah, it's very concerning, which is why I'm glad we have these rock stars investigating this.
Okay, sorry.
Thank you. Great question. Yeah, so the potential associations that are coming into focus, we've got cases that are clustering on the eastern side of Ottawa County with potential clustering on the west side of Kent County. Further epidemiology analysis identified that Wendy's was a common link in Ottawa cases. At a national level, on September 1st of 2022, we had a total of 97 total cases, 43 hospitalizations throughout 6 states, and 0 deaths have been reported. There are severe health impacts that are associated with STEC. Some even endure the intensive care unit out of the cases that were diagnosed in Ottawa County. Hemolytic uremic syndrome was experienced by 3 of our pediatric cases. Those cases were hospitalized from 2 to 3 weeks. One is currently in a rehabilitation hospital and the other 2 have been released. The individual that was transferred to the rehabilitation hospital experienced significant neurological damage, including brain damage, some weakening on the left side of the body, seizures. In addition, hypertension and dependence on dialysis were also experienced from some of the other cases. So what is STEC? STEC stands for Shiga toxin producing E. coli. Some of the common symptoms are diarrhea, bloody diarrhea, abdominal cramps, vomiting, and fever. Something that we call the incubation period, which is the time that the bacteria incubates within the body, is from 2 to 10 days. And after that time frame, a person will start to experience symptoms. The duration of the illness is typically 5 to 7 days, but can have lifelong implications. Something known as a reservoir is where the bacteria starts its life, and that is often found in cattle, ruminants such as sheep, deer, and goats, and can even be transmitted into humans. Now we're taking a step into the outbreak response. Here's a timeline of the environmental health events. On July 27th of 2022, one of our environmental health specialists conducted an unannounced routine inspection at Wendy's in Jenison, Michigan. They cited a significant lack of active managerial control, emergency conditions regarding flooding and electrical issues, and the establishment decided to voluntarily close after guidance from our department and the local fire department. Later that day, they were able to resolve the issues and they were reopened by our department. As you can see, the top left photo indicates chili that was left out at room temperature overnight. And beneath that, we have moldy strawberries. Those are photos that were taken at the time of the inspection. Fast forward, on August 8th, our department was notified of 6 STEC cases. On August 10th, one of our environmental health specialists identified that a close contact of the hospitalized HUS case was an employee at the Wendy's in Jenison that voluntarily closed on July 27th. And it was later confirmed that they also worked while they were symptomatic with illness themselves. On August 11th, we went out to the establishment to conduct a foodborne illness investigation due to these issues and placed a seizure order on all food at the establishment, hoping that the state would approve sampling. Another photo at the bottom right hand of the screen, we have a raw ground beef residue that was found on a spatula. The spatula was used for cooked hamburgers. We have a cross-contamination issue that in itself could cause severe illness. On August 12th, environmental health conducted samples of raw ground beef, romaine lettuce, and tomato at the Wendy's location. These were the implicated food items that were of suspect. The samples were then delivered to 2 state laboratories in Lansing, Michigan. On August 16th, the state came out to the establishment to collect additional samples of romaine lettuce and tomato. And at that time, our team was at the establishment as well, verified that the outstanding violations were corrected, reviewed the flow of the food of the implicated suspect food items throughout the establishment, discussed changes that may have occurred during the time frame the illnesses were reported, and approved the establishment to reopen. Diving a little bit deeper into the sampling process, typically with outbreaks associated with fresh produce, they're shorter in duration because they have a shorter shelf life compared to a product that is frozen or canned that may remain in a person's freezer or on a shelf for a longer period of time. Whereas sad romaine, which we've all experienced before, which is pictured on the top of the screen, a consumer may discard that. And typically if that produce is contaminated, it's per lot. So once that's out of the system, then if the issue that caused the contamination was resolved, then that outbreak is typically over. On August 25th, our environmental health specialist conducted an unannounced routine inspection at the establishment, noted no repeat violations from the time of the voluntary closure, and active managerial control was demonstrated. So positive outcomes. There are a few highlights that I wanted to share with you that sets Ottawa County's response apart from other jurisdictions. We were the first local health department to conduct a foodborne illness investigation at the Wendy's establishment regarding STEC outbreak. NEARS assessment was completed, which included environmental sampling. And the specific NEARS assessment helps us address the root cause of an issue. So our team was really focused on really, determining what was the issue here, how can we help, and how can we prevent this from occurring. Our staff members provided education on site to the employees at the Wendy's location to help support them. We received an increase in foodborne illness complaints that were also investigated during this time. And we also held daily meetings with Wendy's corporate, Meritage Hospitality, state, local, and federal partners. And on the right-hand side of the screen, you can see some photos that were taken during the time of the different investigations and inspections. Now that you've taken a step behind the scenes, I wanted to help everyone stay informed. So we're going to learn how to access weekly inspection reports for licensed food service establishments in Ottawa County. You can start the video. Thank you. You're going to navigate to miottawa.org/food. Right on that main page there, you can scroll down and type in a food service establishment's name that you're interested in learning more about. Click on the inspection report tab on the right-hand side, and all the inspection reports that have been completed by our inspectors will come up. And you can view what we saw at the time of the inspection, and that can help you decide where you would like to go out to eat and where you would recommend your family members going to eat as well. You can also report a concern to our department if you're out in an establishment, if you experience symptoms of illness after eating somewhere. The CDC estimates that 48 million people become sick from a foodborne illness each year. 128,000 are hospitalized and 3,000 die. You reporting your concerns to our department can help prevent foodborne illness before it starts. So we appreciate your engagement. You can go to the same website, miottawa.org/food, and you'll see the report a concern tab on your right-hand side. Click on that and simply fill out the form, and our investigators will look into it further for you. In summary, thank you, Ottawa County Commissioners, the STEC response team, administration, our community members. We care for you, and your participation truly makes a difference. Thank you.
One other question I thought of, all these restaurants, and I feel for them, they're going through hell like water. Okay, they can't do it. Okay, the owner of the restaurant, which could be a corporation, okay, and they have a manager on site. Is that manager required to have any type of training in food safety before he can be a manager?
Yes, they are required to hold an accredited food safety certification.
Okay.
And they must be on site at all times. And if not that individual, they oftentimes have 2 or 3 different people. So when they're rotating shifts, there's always coverage.
So they always have somebody with that training, so they know better.
Right.
Okay.
Yeah.
Okay.
Done this for years, and I just have to compliment Kayla and the whole food team. Every time I've been through this, I'm just utterly impressed by the commitment of our team, the expertise of our team. I learn new things all the time from our team. They get it done because we always keep our eye on the end game, which is preventing the spread of disease. Sometimes we come out of this not ever even knowing what the source was, but by doing all the steps that Kayla described, investigating the food establishment, interviewing all the sick people to identify common food sources, doing all the epidemiology around all of this data that we're taking in, we can usually get pretty close. And that is what helps us to really curb more people from getting sick. It's important work. It very often happens behind the scenes. Sometimes we only have small outbreaks where people aren't hospitalized, thankfully. But it's very necessary. And I'm thankful for our team.
I'm just hearing what I hear in the news.
Yep.
They're saying it came from the lettuce that Wendy's bought, right? And they buy a lot of it. So do they know where that lettuce came from and when that happened or not?
They don't at this point, and maybe Kayla has more information than I do. This is still under investigation, and they haven't determined for sure that it's the lettuce at this point.
Oh, okay.
Now, we can speculate, right?
Yep.
Wendy's pulled the lettuce.
Yeah.
They were very proactive. I have to compliment Wendy's in this. From the very first phone call that we had, they took this very seriously, and they, were concerned about their customer base. They pulled the lettuce because they thought it could be the lettuce.
Yeah. Yeah.
There's a whole lot of testing and laboratory stuff that goes to the state lab, and then it goes to the CDC, and it has to be serotyped and all kinds of stuff before we can even associate all of these cases with each other. And we talked primarily about our outbreak here in Ottawa, but there was also Kent, Oakland. I think it was pretty far and wide across the state of Michigan. We also learned very early on that Ohio had clusters of cases. And you can see how it can get very complicated very fast. There's a lot of communications going on. We were having calls with the CDC and with, like Kayla described, with our own 3 different state departments. I think it's interesting to see how it all works behind the scenes.
Kayla,
Yes.
of the total number of people that were involved in this, that had it, were there more than just the 3 cases of kids, or were there more kids that just weren't affected as serious?
In Ottawa County, that's a great question. There were 3 pediatric cases that were linked to this specific outbreak. And when I'm stating this outbreak, this is connected with the Wendy's and Jemison. So we were able to link that together. So only 3 known cases. But food borne illness goes unreported.
Yeah.
Some people don't associate that with the food that they ate, or maybe they think it's normal and they experience these symptoms quite frequently. So there's likely other people that may have been involved with this outbreak, or others that we're unaware of.
But Kayla, how many were there total? Not just the pediatric cases. How many did we have in that whole cluster?
For children,
No,
or
adults,
Oh,
children,
everybody.
total.
there was 13.
13. Okay.
Yeah.
Now, E. coli in itself, you can get sick, can't you? But this is more or less the toxic. Often the E. coli is what really, it's kind of like a super bug.
Yeah, so E. coli is one of the most abundant bacteria that lives in our digestive system. And then, it's usually when it becomes a problem is when it's somewhere it doesn't belong. So for example, it can cause bladder infections if it gets out of where it usually lives. But this particular type, yes, it produces a specific kind of toxin that can make people very sick. And this is why we have our teams really watching for it. And, so I've been at the health department now for a year after 15 years of being a community doc, right? So watching this unfold from this side to me was amazing, because, how many times would I have a patient come in, oh, it's probably something you ate, don't worry about it unless you're dehydrated, call us back. This really illustrated to me the importance of, even if you're not sure that something you ate is what made you sick, let the health department know, because then we have this crack team of amazing people who can really track it down. In fact, just looking at that timeline that Kayla presented, I was actually homesick the day that this sort of popped up on the radar. And I remember seeing an email come across that a doctor at Metro called our team and said, I have 3 people in the hospital with this particular infection, and we don't usually see this. And that right there was enough to get everybody's spidey senses tingling. And now we have this whole investigation that just blows my mind. It's amazing to watch. You guys are amazing.
Thank you.
Is it detectable blood tests or?
It's usually a stool sample.
Stool
So,
sample.
yeah.
That's what-
Yeah, right. Which is another reason why a lot of times it goes undetected, because
Yeah,
Yeah.
because that's an unpleasant
yeah,
experience.
nobody really wants to do that.
You
But
know, something, and you said you had 3,000 deaths. And when you get this, you feel like you're gonna die.
Mhm.
I got a good example of what happened. So, this is not what you want to have happen to yourself. So,
I have a question.
yes.
Lettuce.
Yes.
My wife has a problem with lettuce if they spray it to keep the color.
Oh,
And I think some restaurants still do that, although they're not supposed to be able to do that. Is that correct or not correct?
Unless it's water, then they should, they shouldn't be spraying it.
Chemical that they're using.
Oh,
Because my
probably
wife
some
gets
sort of preservative.
instantly
Mm.
if
Yeah.
the chemicals on the lettuce.
Yes, yes.
And she has a real problem with this.
Have her reach out to her department if there's specific concerns that she has, or if it's related to an establishment, and we are happy to look into it further.
Because she won't go back there to eat.
That's understandable,
It
yeah.
eliminates restaurants,
Kayla,
Yes.
you can help me with this. We have over 700 licensed food establishments.
Correct.
Correct on that? Okay. And the state requires us to do 2 routine inspections per year.
Mhm.
And then there's a whole process if they find, they don't call them critical violations anymore, they call them what?
Priority and priority foundation violations.
Priority and priority foundation violations. Every year they change it up to confuse me.
That's right.
Okay.
And so then we have certain procedures that we follow when we find these priority violations. And I'm telling you this only because when we're not in an outbreak situation, there's really a lot of very important work that's taking place. Our team, you guys have been here for a while. You remember the days when the restaurants really, really didn't like the health department a whole lot because they saw us as,
No.
regulatory in nature. And again, we made a very strategic change in our approach with the restaurants. We changed from, we're here to regulate, to we're here to help you be successful. And we do routine customer service surveys. And the most recent one, I think it was like 97% of the food establishments reported to us that they feel free calling us to get help. They trust us. And they have great relationships with their food inspectors. And I paraphrased that a little bit. There was probably different wording, but it's been a dramatic shift. And we've seen just improvement overall in the food handling practices in our establishment since we made this change, which has been probably about 15 years ago now. But it's a good process and a necessary process. And we're working really hard to keep people in our community safe so that you can go to a restaurant and enjoy yourself and not
Okay.
worry about,
That's the word.
food.
I'll pass the name on to you. a little bit.
Yeah, that'd be great.
TV.
Hey, Kyle, are you in line?
Yep, I'm here.
You got any questions?
Yeah, I just have a quick question. How many are you guys finding a lot more restaurants with having issues in like the last few months, or is it restaurants being able to like keep up and keep everything pretty clean?
Since COVID, we've been seeing quite a shift, an increase in violations, and there's a lot of workers that they don't have enough workers. They're really struggling on that end, and it's been difficult for them. And that's where the relationships that we built with them really come into play. We're able to support them. We understand they come to us when they need help. But yes, we have seen an increase in violations, which has led to, enforcement, which is where Lisa was kind of leading into, just to give them some structure to prevent the foodborne illness from potentially happening.
And then are those all listed on your guys' website, correct? All the
Yeah.
violations?
Yes. Yep. You can look it up per food service establishment, like the video showed.
Okay.
And
Is
if
that
you-
pretty easy? Yeah.
Had
Okay.
an enforcement hearing with one of our food establishments that had some priority violations. And when this individual left, he said, wow, I came here thinking this was going to be horrible. And he said, but I just want to thank you because this was so helpful. And this manager learned a lot, and he was very open and willing to taking it back to his team. I mean, it was a very positive experience. So, I think things are going as well as could be expected.
Yeah. Okay. Thank you.
Any other questions for Kayla? Thank you so much for showing up and explaining it.
You're very
It's always good
welcome.
to know.
Yes, feel free to reach out with any questions.
Okay.
Kayla.
Okay, next on the agenda is department updates. Madison, how many people are online?
Just Carla and Jennifer.
Okay, Jennifer, are you online?
Yes, I am here.
Okay, how was lunch yesterday at the corner of Chicago Drive and 120th or Waverly?
I am not sure.
Because I saw a lot of community action vehicles there.
Oh, maybe Community Action House,
Yes,
possibly.
okay,
Yeah.
okay. I thought that was you too. Okay,
No, not us.
okay,
Yeah, I'm sorry I can't be there in person today. We had some interviews this morning that ran a little longer. So updates for Community Action Agency. We are working on hiring our 7th person. We're slowly growing, which is very exciting for us since we're very small. We are looking to hire an assessment and eligibility specialist. So this person will help us with our weatherization program, which is again expanding. Again, I'm going to sound like a broken record every month until we get the money. So any day we should be getting dollars to expand our weatherization program to provide families with utility savings in their home, some energy savings costs, which is essential for families that are struggling financially. We are supposed to be doing about 2 to 3 times the production that we currently are doing. So we'll be ramping up significantly. Again, looking for contractors to provide this work. One of the plans that we have for expansion is to potentially host an open house so that we can have individuals that might be interested in doing some work for us as contractors to do things like insulation, weather stripping, those types of things in the homes, as well as inspectors to work contractually with us to do our pre and post inspection to make sure the work is done appropriately. Our hope is we've started some communication with Michigan Works, and we're hoping to possibly host at their facility next door to us at near GRCC. So I will keep you posted once we have a date set on that. That way we can promote it out to the community. In addition, we are working or we'll be starting strategic planning toward the end of this month that will continue on through November. So we're really excited to be doing this process with the Office of Strategic or the Department of Strategic Impact internally. And we are just also wrapping up our CARES grant. So our CARES funding is ending September 30th. So we are helping individuals with utility assistance, and that will again end September 30th. We will still have some utility assistance funding after October 1, but it'll be a little bit more limited because we've had a lot more funds for CARES. So we are going to be applying for ARPA funds through the county. So we'll be submitting that application by September 30th with the intent of hopefully continuing our CARES, that utility funding similar to that of CARES. So we're excited to submit that as well.
thank you. Any questions for Jennifer? Okay, Lynn, You're
Good
up.
morning. I'll give you a couple updates from community mental health. Our numbers of people requesting services continues to be high. This time of year, when school starts, we typically get quite a few more referrals for kids. Teachers are involved, and there's just a lot of new things that these kids are learning, obviously, in a new situation. So we frequently get more referrals for kids during the fall, and that's what's happening for us. Staffing continues to be an issue for our internal staff. We've got a few positions which have been open for one of them for a year, several of them for a couple of months. And it really just is a reflection of the scarcity of especially master's level positions in the state and throughout the country. In particular, the direct care worker shortage continues to be really very critical. We are paying close attention to the contract providers we work with to see how they're doing with staffing. I mentioned in the past, one of the solutions we've developed, sort of a long-term and long-range solution, is a direct support professional. Direct care worker and direct support professional are describing the same kind of person, those people who work directly with individuals who have mental illness, developmental disabilities. We are working with GRCC to start a pilot program for certificate for direct service professionals. That's actually going to be starting in November. And it runs, I think, 14 weeks. And so we're pretty excited about that. We've been talking about this for about 7 or 8 months, which I think is actually a short time frame to get a pilot program up and running, a curriculum written. The hope, again, is that this will attract people into this field, and people will look at this more as a career than a first job. So we're pretty excited about that. We are using some millage dollars to increase access to counseling. A lot of, I've told you multiple times in here, but and I just mentioned that we do have an increase in requests for services. That's true pretty much across the system with behavioral health care providers. So these millage dollars are going to help support some of our local partners in their ability to provide more service, outpatient counseling to adults and kids. We're starting a new work group with the Michigan Department of Health and Human Services and the state ARC, which is the association. It was for retarded citizens. It's now an umbrella organization for people with intellectual and developmental disabilities. It's the work group and the project is called Partners Advancing Self-Determination. So we've invited some parents, some other agency partners, community partners to join us in that. The goal is to improve our delivery and our understanding of self-determination through at CMH. The last thing I wanted to tell people about the Recovery Fest, it's an annual event that we help sponsor, is Thursday the 22nd from 4 to 7:30 p.m. at the Holland Civic Center. And the Recovery Fest is a place where people can go to get information about recovery services, SUD, substance use disorder services. They've got live music, they've got lots of partners who participate to provide information. So if you're available that evening, we'd appreciate it if you could attend. And that's all I have unless you have questions.
Any questions? Kyle or Randy, any questions?
Nope,
Okay.
I got nothing.
No, okay.
Lynn, there was funding to increase the hourly wage of direct care workers. Has that extra funding ended?
No,
That's still going on?
yeah, the direct care worker, it's kind of known as pass-through dollars.
Okay,
So that's funding that the department sends to the PIHPs to be distributed to the CMHs, and then obviously onto those people providing those services through agencies.
right.
And that those dollars were included in our rates for the first time this year, and we anticipate they'll be included in our rates next year, the same amount, $235.
So what is there a standard hourly rate now for direct care, or is it still
There's-
depending on the provider?
Yeah, there's not a standard
Okay.
rate.
Okay. Lisa?
Just a couple things. You may remember 5 years ago, we applied for and were granted, it's called Project Public Health Ready. And what it is, it's a criteria-based recognition program that assesses local public health capacity and capability to plan for, respond to, and recover from public health emergencies. This is like a national recognition program. It's kind of a big deal when you get this recognition. There aren't very many health departments across the country that have this. We did receive this recognition in 2005. It does require us to reapply every 5 years. So our most recent application just went in and took a pretty heavy lift by our emergency preparedness coordinator or manager, excuse me, and a number of other key emergency response personnel within the department. So we're looking forward to that result and hopefully carrying on that honor moving forward.
When will you find out?
I don't know. I know that it's like going through accreditation. So they have to review all of our documents and they, interview some team members, and it can be quite lengthy. After COVID, some things with national accreditation and local or state accreditation have changed. So I don't know the answer. I can certainly find that out and let you know. We also are in the process of working on a remodel in the clinic side of our building. So, our office on James Street, on the right side of the building is more administration and where Jen's office and team work. And on the other side is where all of our clinic services are provided. That's been quite a few years since anything has happened in that space. And so I think it's a project that's really needed, and we're very thankful and we're excited to have that area reworked. And I know our clinic team has been working on really designing it for our clients. So client-centered, excuse me, client-centered design, and John's team in the facilities, thank you. The facilities team has been working really closely with us. So I don't know when that will be finished. I think it will be started within the next couple months. So when it is finished, we hope that you'll come and visit us. It's going to be great. Thanks to you guys. So I think, let's see. I think I mentioned about accreditation being on hold, but we will have an audit. So we're doing some preparation for that. We've made a few new hires that we're really excited about. One in particular is a maternal infant health program supervisor. I think that's probably the highlights. Glenn, I saved the monkeypox and COVID and all the disease stuff for you.
So Kayla already covered the disease of the month in detail, but I have a few other diseases up my sleeve I can tell you about. One is, again, Lisa just mentioned monkeypox or MPV. We've been working still really hard on the response to that, and things seem to be turning a positive corner kind of nationwide as well as locally. We've had a great response with vaccine availability. We've done some targeted outreach for the folks that are most affected by the MPV outbreak. And so far the response has been very receptive and just very encouraging to see folks taking advantage advantage of the resources that we have available through the health department. And then, of course, COVID is still with us, but we are very, again, encouraged by the fact that our long-term care facilities have been very, very receptive to partnering with us as we've been able to actually take booster vaccine doses to them, to the folks that otherwise wouldn't have easy access to it. And now with the new updated vaccine available, they have been reaching out to us to ask, when are you going to come and vaccinate our folks? So we're very excited about that. And last but not least, an initiative that I'm very, very excited about that we're very close to launching in the clinic is a hepatitis C treatment program. And this is something that has gone through a lot of changes over the years. It used to be hepatitis C. There was no treatment for it. Then there was a treatment, but the side effects were awful and it was really expensive and only specialists could do it. Now there is treatment available through an initiative at the state called We Treat Hep C. And in our clinic, we're getting ready to add that to our list of services. So folks that have no insurance, that have limited insurance, or maybe whose primary care doctors aren't able to treat them within their own office, they can come to us and we can treat them, or we can partner with their primary care doc. We have access to specialists at the university level and then at the state level if there are things that are a little bit more complicated, so that we can just call up a specialist and say, hey, what should we do in this situation? So we're very, very excited to be adding that to our list of services in the clinic, and that should be happening very soon. So
Thank you. Any questions for, or I should say, Lisa and Gwen?
No, none for me.
Okay. Joe, Jim, nothing? Okay.
Can I just say one thing?
Yeah,
So I think since last time we met, it was announced that I have decided on a retirement date. And, with any retirement, it's a kind of a good thing and kind of a scary thing, right? But mostly I'm excited. I've been thinking about retiring for some time. By the time I retire in March, I will have reached 32 years of service with Ottawa County. And I just want to say how much of an honor it's been to serve this board and to serve the community members in Ottawa County. I've really loved every minute of it. I feel like I've grown up here. I was 10 when I started. But it truly has been an honor, and I thank all of you. And I just know that John and his team will find a stellar, talented individual to step into that health officer position that will continue to serve our residents with integrity and excellence. So thank you.
thank you, Lisa. Okay, next thing is public comment. Is there another public comment? Seeing none, we are adjourned.